Let's still talk about COVID-19, but this time focus on front health line workers. At least 779 health workers have tested positive for COVID-19, which according to the joint health unions is as a result of inadequate PPEs for frontline health workers. The unions say 190 members of the GMA, 410 nurses, 156 members of the Health Services Workers Union and 23 members of Pharmacists Association make up the number of infected health personnel. 9 have unfortunately lost their lives. The group wants government to regularly supply all healthcare workers with PPEs to prevent a breakdown of Ghana's healthcare delivery in the coronavirus season. The unions are urging the government to have a quick relook at who qualifies to be a frontline health worker, as most of its members that have contracted the virus are not in the frontline category. Dr. Frank Ankopia is president of the Ghana Medical Association.
This address was by the various unions, health sector unions and associations, professional associations. We came together because our people are suffering. The rate at which doctors and nurses and other health service workers union are getting infected is at an alarming rate. Can you imagine 779, 150 doctors, 410 nurses? In fact, already we've lost 4 doctors, we've lost 3 nurses, we've lost 3 health services workers union members and all that. And we think this is unacceptable. So we organized this press conference to come out with some of the reasons why these things might be happening and to draw the attention of government and the attention of the public to it that, one, COVID-19 is real. We, the health workers who are fighting COVID-19, are being affected by the virus now. So we needed to make people aware that it is real. So if they allow themselves to be infected by not abiding by the safety protocols, what will happen is that they will eventually bring it to the hospital and will be affected. And if care is not taken, there will come a point when by the time they come to the hospital, they won't have anybody to look after them, including also people with other diseases who won't come in because most of us will then be in quarantine. And then we wanted to still appeal to government that the personal protective equipment must be made readily available. We should have them in abundance in the hospitals. There are challenges like some of the drugs may, every now and then, we may not have access or we may not have some of the drugs available every now and then. And that is why we are appealing to government to make sure all these things are there. We spoke about definition of frontline health worker. From our statistics, most of the people who have become infected do not fall into that criteria. And so we're asking government to take a second look at the definition of the frontline health worker. All staffs, all health workers. We thought that it should be broadened out to include all health workers. That is what we are saying. Because the statistics that we have, those who have, most of those who have become infected do not fit the definition of the frontline health worker. So it means there are people who are not considered as frontline health workers and yet are getting infected. And these people are more over and above those who fall into that category. So government must have a second look at the definition.